And we are back. You're listening to the WCEG network on WCEGTalkRadio.com, the worldwide community empowerment group. Like us on Facebook, where we are streaming live. Follow us on Twitter. Follow us on Instagram. You can call in, Skype in, whatever. Oh, wait, I forgot. YouTube Live TV. We are on YouTube Live TV as well. So either way you go, you can find us. And we appreciate you listening and joining in for the conversation. I'm Myrna Taylor Ransom, and joining me today, we have a field of medical experts today. We have Dr. Chivon Stubbs. We have Dr. Janella Thomas Burse. We have Dr. Charles So, and we have Nurse Pamela Davis, our traveling nurse. And so we have a bevy of information experts here today that can help us with anything that's for our good. And today we've been talking about cannabis oil or CBD oil and its impact and its help in a lot of different medical areas. And if we could just recap some of the information that we were given about some of the things that it's good for.
Depression, anxiety, Parkinson's, seizures, headaches, autism, ADHD, anxiety, the list, cramps, reproductive issues. Again, we have receptors all in our body, in our nervous system, our immune system, our reproductive system. Our bodies are made for it. One thing I did forget to say is there's a website called ECHO connection.org. There's a lot of education on there about CBD, and you can also look up the research that's been done on different disorders. So if you put in Alzheimer's or things like that, it's in alphabetical order. You can see what research has been done with it.
Okay, would you repeat ECHO?
ECHO Connection, ECHO connection.org.
And they have a lot of information about CBD oil?
CBD, yes. You can. It will tell you what we talked about, where it comes from, the difference between that and marijuana, and as well as different disorders that about it, research regarding different disorders in CBD. So very educational.
And you recommend it as a medical expert. You recommend CBD oil.
Yes. Highly recommend. But because, again, risk benefits, you're not, very little risk, can't OD, and potential benefits. And again, we're all individuals.
Right.
Everybody's different. So I'm not going to say what's going to work on you or not. I can't say that.
I've got a text here that says, is CBD oil covered by insurance?
Please.
Good question.
Not yet. Yes. I mean, this is the beginning. This is the beginning. Yeah. Again, it shouldn't be the beginning. It shouldn't be the beginning. It was already out there, already being used, already being prescribed. Again, the American Medical Association was against the illegalization of both cannabises. Marijuana and CBD and hemp. So if that had not happened, it would just be normal. We wouldn't know any different.
Yeah, but also to say it's different from THC.
We talked about that. Yes, okay. We did. We definitely said
we already discovered
hemp is majority.
No intoxication.
Right. It's non-psychoactive cannabis. It is cannabis, but we stress that like a zillion times. Non-psychoactive cannabis from the hemp plant does have a little bit of THC, but very little, less than 0.3%. So those, again, we did get in that part that those people who work where they may get drug tested, they need to really be careful what CBD they're getting. There is CBD with THC extracted that you can use. But again, you need to do your research. Don't just go to the store and buy whatever CBD you see. Look at the company, research the company, find out, and know, is that what they're saying on the label, is that in the bottle, okay? Where is their hemp grown? Again, hemp is sustainable. It's good for the earth. It takes toxins out of the earth. Where is it grown? Okay, you don't want to harm yourself by thinking you're getting yourself healthy by taking. And how is it extracted? How is the CBD extracted from the plant?
Right. Okay. Well, I've got my sample, and I'm gonna try it and see if it works. I'll be able to. I can't let you know before the show is
You
over.
might,
but
depend what it is.
Well, I tried it and I put it on my kneecaps and woo, I'm getting a little bit higher.
Already, see?
already, huh?
Yeah.
And like I said, sometimes people say, "Oh, that's a placebo effect," but again, you see it too much.
Yes.
You see when you see things over and over with your own eyes and experience it for yourself. But again, please be careful what you buy. Please be careful what you buy. Learn about it. Look it up. Go on echoconnection.org and learn about it before you just go buy it.
Okay. We'll have to do that. Now, I guess we are advocating the use of it, CBD oil, and it comes in various forms.
Right. The salve.
The salve as we have here.
It comes in a vape. It comes in a sublingual form. You can put the oil or the tincture under your tongue. The vape and the sublingual quickly goes into your system.
Because
you can ingest you can ingest it via capsule or swallow the oil, or again, coffee, tea. There's coffee CBD, tea CBD, gum. So there you can ingest it.
Now, our producer who was telling us about in Jamaica, what they do in Jamaica with the tea, he said they never got sick because they always used the cannabis oil in hot tea.
Right. Immune system.
Well, made a tea out of the leaves
Immune
of
system.
the cannabis plant or the hemp plant.
Correct. The immune system. There, like I said, receptors. There's two types of receptors.
We already have receptors in our bodies.
Right. It's two types of receptors, CB1 and CB2. And CB1 is predominantly in the central nervous system. CB2 is predominantly in the immune system, but it's also in our reproductive system. But remember, the immune system is everywhere, particularly in the gut, in your intestines. So very important. And that's another digestion. So they're doing research with on CBD with IBS, irritable bowel syndrome, psoriasis, PTSD.
Oh, you talked about eczema too.
Eczema, you can rub it on there. Now, psoriasis sometimes, because that's a deeper condition, so that may take some time. You may not get an immediate effect from it, but like we said before, depending on what's going on, it may take you 2 or 3 months before you see something, see some improvement. So, yeah.
It's trending now. And I'm
we need to know.
An advocate for it because I like what I see so far, and I like what I hear in terms of the research and things that are happening, people's testimonies, and that's basically all we have right now.
Right, and we need to know. And like I said, we need to know the history. I keep stressing that, but I think I stress it too because if it weren't for that history, again, we wouldn't be having this conversation because it was in like 80 to 90% of most medicines back in the day. So, you know.
And it was in medicine already.
Right. We were using it. It was the norm. It wasn't a big deal.
And we probably weren't as ill either.
That's what we were saying. We weren't.
We wasn't.
We were dying from infectious diseases.
That's
what
because
was killing
of what?
people.
We didn't get our immunization. And that's where we're going.
And that leads, perfect segue.
And with that, we're going to use that as a segue and go into our immunization topics. Summer camp is coming up, and kids have to show that they have had their immunizations for the school year. And also there are some adult immunizations that are necessary at this point, too. So let's talk about that.
Get your vaccines.
In a word, huh? Get your vaccine.
To make the long story short.
Right. That would do it.
That's
What's
true.
what's coming up for adults right now?
It depends of your age and it depends of your condition also. But for adults, starting at age 60, one shot that we recommend is a shingle shot. Because chicken pox, you have a chicken pox as a child and you stay dormant, latent, nobody hear about it. then at a certain age, now your immunity decrease, and that virus wakes up again and gives you a rash. But it's just not the rash, it's also the pain that goes with it.
Yeah, I understand that shingles is very painful.
Very.
Yes, it's painful. Even if the rash, when the rash disappear, sometimes you have the pain without the rash, or you have the rash, then you have the pain, then the rash. Even the rash get better. You can get, if you start taking the medicine, the rash get better, but the pain can stay there for weeks or months. So that's why it's good to get your shingle vaccine.
And it's like that neuropathy pain we were speaking about earlier, nerve pain. It's the pain that you get with shingles.
So after that is your pneumonia shot that you need to get at age 65.
Shot.
Yes.
And how often do you have to have the pneumonia shot?
The pneumonia shot is 2 shots. One that we call the Prevnar that you get at age 65. The second shot, the second pneumonia shot, you will get it at age 66, which is a year later, and that's called Pneumovax. It's different. It covers different type of pneumonia. So you get the first one, then you get the second one.
But now, if you're diabetic, you may have to have these pneumonia shots before 65.
Yes, but before that, there is another shot that we need to talk about. This is the flu shot.
Oh, yeah.
Yeah, the flu shot, you get it every year. And if you 65 and above, you get what we call the high dose. Because
High who?
high dose.
High dose.
Yes, because your immune system is not as good as if I'm in my 50s or 40s or 20s. So you get a high dose. But those are the main shot that you first get a tetanus shot also every 10 years. But otherwise, those are the main shots that you get as an adult. But if you have diabetes, you need to get the pneumonia shot at your time of the diagnosis. If you have asthma, you need to get a pneumonia shot too, which is the Pneumovax. I'm talking only adult shots here. I'm not talking about shots in children and adolescents. If you have sickle cell, you need also to have the pneumonia shot at the same also. So those are, and also HIV, you need to have those shots done too. So what that means, if you have an immune system that is compromised by a condition, you need to have those shots earlier.
So it's more of a proactive kind of
It's prevention.
prevention.
Yes, it's all about preventing disease. We don't pay attention to it because I'm from Senegal and I can see kids with polio. You don't see.
We've actually eradicated polio in the United States.
Yes, but
In the
polio,
U.S.,
In the U.S.
but not
polio-
other places.
polio has been eradicated also in Senegal, but you can still see these adults
Who had
that had it. You don't see any more kids having polio, but you can see adults with polio. So you see them, you know that if you don't see kids with polio, it's because we have the shot, the immunizations. So it's the same with
A
measles.
lot of people, though, will not get the immunizations.
Is the measles also. We talk about a lot about measles these days because measles is back.
It's a decreased in vaccinations.
I saw that yesterday on the news where measles is on the uprise.
Yes.
It was gone.
It has
too.
been.
It was gone.
It was
It was
gone.
Here
gone.
in the
Wow.
U.S.
The only thing is now is the democracy. Parents can say we're gonna opt out of vaccination. It was okay before because you have all these people around you that have this immunization and that was protecting you.
Herd immunity.
And that's what's herd immunity because people around you already have the vaccine and they protecting you, so you are okay. But now this you have that community is getting larger, bigger, so they're not protected anymore, and they pose a threat to others.
Especially those who can't get
Yes,
vaccinations.
vaccine,
right.
So
yes.
that's the problem. You're making a choice not to, but there are people who cannot get the vaccines.
Cannot for what reasons?
Maybe if they have had severe allergic reactions to components of the vaccines, which is really rare. It's not a case that we see with everyone, but in rare cases for those patients that may have severe allergic reactions or may not tolerate some of the different components that are in vaccines.
And if you are immunocompromised, correct, then you may not be able to get the vaccines.
No, it depends. If you immunocompromised, you cannot get the live vaccine.
The live vaccines, right?
Yeah,
So
but
the
if-
MMR,
Yeah,
measles, mumps, rubella.
yeah. So which is a live vaccine,
Right.
so you cannot get it. But if it's a kill vaccine, you can definitely get.
But that's the scary
And that
part.
would
Yeah.
be
You can't get those live vaccines.
the live vaccine because
Those are
it's
there is
giving you the disease.
yeah, vaccine is trying to give you the disease, but if the virus is killed, so you really don't get the disease. What you build up is
You're building your immunity
the
to that
immunity.
disease.
If it's a live vaccine, they give you, you get the disease, but it's mild, so you can now build your immunity from there. But for people that are immunocompromised, they cannot build their immunity. So that's why we cannot give them the live vaccine. So we give them the kill vaccine. So here, so if you vaccinate the large community, the few that cannot get the vaccine are protected. But now we give the freedom. You register your kids to school, and they're not required to have their vaccine.
But that's not true in Georgia, is it? We are required.
It's a requirement. I have to look at the law again, but you always can put a
You can
note
opt out,
and
I think,
opt
still.
out and not
Really?
getting vaccinated.
You can opt out in schools now to not get vaccinations.
Unfortunately,
Unfortunately,
Wow.
that is
I
the
did
case
not know
now.
that.
Which is
Because
why
that's
we
why the
see
problem. That's why we
so
have the problem.
much rise in these preventable diseases that 10, 20 years ago we didn't see thanks to vaccines have now start to come back because parents are choosing not to vaccinate their kids. So
And some other, another population is the pregnant population. We offer flu and what's called the Tdap, which is the main part of that we're concerned about, is pertussis or whooping cough. So some of the pregnant mothers do decline that, and then we have to tell them this is the risk to your baby because you're supposed to be
And
imparting
then that's when they
antibodies
take
to
the
your body.
opt out, right? When you say it's at risk, when you say that the babies
Right, the
are
baby's
at
at risk, and they don't have a choice. They don't have like the kids don't have a choice if the parents say,
Right.
"Don't vaccinate my children." Till they get 18, like the one who did take his mom to court and.
I remember that, yeah.
And the studies show it's actually more cost effective to have children vaccinated than to not have them vaccinated and end up with these diseases, a lot of them that can be so severe that they lead to death. So the time that parents spend off of work, the loss of income there, hospital expenses, when you can just, get your insurance copay that covers vaccination, that you're already paying for the insurance, out of your pay every month. It's just cheaper to go the safer route.
But we go back again to education, and then where are you getting your education? Because that's the main problem is that people are getting educated on social media that had these false stories about vaccines, and
That's like, where'd you get that information? The internet?
The internet.
So I have a question for the younger people here. Are we at risk for catching the measles?
For younger people? Oh, you
We've
mean
been vaccinated.
us younger people?
The younger people that's here?
No, if you're vaccinated, you have less chances to get the
Well,
disease.
let me just say, when I was a kid, I had vaccinations for measles and mumps and
let me see.
chicken
Yes.
pox and all of that. I still came down with all those
What was
diseases.
that one?
I think that's the polio.
That was
That's,
the point.
that's my ouchie.
Yeah,
A lot of people
I have
have
one
that.
of those. And I still came down with measles, mumps, chicken pox.
Well, we didn't have the chickenpox vaccine back then.
And I never,
We didn't.
and I've never
We
had
did it.
that.
We were
Thanks,
put out
Dr.
there.
Jan.
No, we were all like that. We were put out there to go get, such and such has chickenpox down the street. Go down there and get chickenpox.
That's right. And I've never had chickenpox.
Really?
I had the whole third grade got
That's the
them.
one where you, that's the one where you have to have that
Oatmeal
sardine.
and the no, that's the mom.
Oh, yeah, that's right. Okay. Well,
The chickenpox is where you get the oatmeal and the
Calamine.
the
The
calamine
chamomile.
lotion. Yes, when they paint you.
yeah, pinky pink.
I was too young to remember my chicken pox, unfortunately. I
that's
got them
good.
from my
That's-
brother, though.
Really?
I did.
And your mother probably
you-
wanted you to go ahead and get them. That's how we got them.
That's how
then
you
they came out with the
built your immune
vaccine.
system. Yeah, once you have it, you're pretty much free. Until now that I'm older, since I had chicken pox, I can still get.
You need the
Yeah,
shingles,
Shingles
that's
vaccine.
why, that's why
what he
you
was
need a
talking
shingle
about.
vaccine.
Okay.
Well, I need the vaccine.
It wouldn't be so bad if I didn't like needles. See.
No, it's the only thing
Does
that
it
you
come in a
have.
salve?
No, it doesn't hurt really. The only thing is you get sore a little bit in your arm for a few days. And
See, that's the part. Getting sore in your arm for a few days.
it's better than having the chicken pox. It's better than
Okay.
having the shingles.
put it
It's
that
better
way.
to having these measles. It's better to have polio, which is a catastrophe.
Yeah, yeah.
We're kind of cavalier with chickenpox, but chickenpox can be very dangerous, especially the older you get.
Yes,
The
definitely.
older you get, it can be very
It can kill you.
dangerous. So yes, so we kind of like shuck that off, like it's just chickenpox, but it can make you very sick.
Definitely.
And the rash is not just a rash, it's kind of irritated looking. It's an angry rash.
Yeah, mostly for measles, you kind of get a cold for a few days, maybe 2 to 3 days. Then you start having this rash that come.
And they're little fine little
Yes,
red bumps,
or
like,
and
skin
you feel
tones.
you feel
Yeah.
sick.
Bad.
But the problem with mostly for the measles is very contagious.
Right.
You can contaminate an entire
An entire school.
Mercedes-Benz stadium.
Stadium
Oh,
easily.
my God. That's terrible. You can infect that many
Yeah,
people.
because you're gonna infect the people around you. They will infect other.
then
Yeah, and they go
Yes,
home and
and
infect
they go home
everybody.
and
And
infect
so on.
everybody else.
Yeah, yeah.
Shut down
So,
a community.
Yes.
I do have a question though with the shingles vaccine, because just logically you're saying, okay, I had chicken pox, so I should have antibodies against that already, but then
it comes
Give me-
back in a more dangerous form.
The vaccine for chickenpox is different from the vaccine that you get from the children, which is the what they call varicella varicella vaccine. So
Varivax.
that vaccine is totally different than the vaccine for the shingles. And the vaccine for varicella is we give it only to children. The vaccine for chickenpox is after age 50. And
Shingles.
For the shingles,
Shingles.
sorry. And you get 2 shots. You get the first shot, then 2 months to 6 months later, you get a second shot. It doesn't prevent shingles 100%. But what it does, even if you have the shingles, it will kind of decrease the pain. Because what really bothers us is the pain. The rash, you can get some medication that will take care of the rash in 1 week. All these vesicles, those that you see on your skin, will get dry. But the pain will stay there for a few weeks, months.
Why is that?
because it's along the nerves,
Okay.
and and that's where it just it sleeps.
That's where the virus lives.
Where the virus lives.
Question would be, how young, the youngest case of catching shingles or getting shingles?
I've seen of it in college age students with high levels of stress that trigger reactivation of the virus. However, those cases are kind of rare. It's not your everyday norm that you see, a college student or a young person having shingles. Like Dr. So was mentioning earlier, you see it more in older individuals as their immunity starts to decline.
But also, if you're young and immunocompromised, you can have shingles.
And so we've talked about the flu shot for adults. We've talked about pneumonia shots for adults. Not rubella.
You
but
need the Tdap, which is the tetanus and
Tetanus.
whooping cough vaccine,
whooping cough.
because they lose their immunity for the whooping cough.
Right. And you need
Okay.
to get that every 10 years,
10
like you
years.
said. But if you're pregnant, you get it with each pregnancy.
Yeah.
And everyone in the house should get it. A lot of times, moms are the ones who are going to the appointments and they get it, but dads need
Dads,
those
any
vaccines
caregivers.
as well. Any caregivers that are going to be in the home, grandparents, they should also have that vaccine.
But do doctors now, when you go to the doctor, do they say, "Have you had this shot?" And
You're supposed to.
We're supposed to.
yes.
Especially when you go for your preventive. Now, they may
Yes.
not, even though some people say they should, regardless of your visit. But if you go to your preventive care visit, they should be asking you all of that.
right.
So every year, if she's staying with your annual wellness visits, we tend to pull the shot records from the Georgia Registry for Immunizations, and we can see when patients have had their immunizations last in order to make recommendations and inform patients if they're up to date on those vaccinations.
Okay.
So would you suggest the TB test as well when they're carrying pregnancy, when they're pregnant, expecting?
It's population based. Where I trained, where I did my residency, was in Detroit, for new OB patients, everybody got a TB test. But it depends on the population. Everybody doesn't do that.
Right.
And we don't give the TB vaccine, which is the BCG vaccine, in the US. But in other countries,
They get it.
they get the BCG vaccine. It doesn't work well, but that's what they have to to prevent TB. But in the US, we don't give that vaccine. We test you for TB, and you can have active TB or latent TB, which is no symptoms, and both will need to be treated.
Those are the only ones that, as adults, that we need now. Those have we basically covered those for adults?
Yeah, those are basically the vaccine that we need for adults. Now there is the immunization program. I call it immunization program. That's for from Burse to
Until you no longer need any shots.
no until 18?
Yeah, about 18.
Yes. So you have it's a program. You can get shot at birth. Mostly we start with the hepatitis B. Then you come at 2 months. You get a series of shots. Come at 4 months, 6 months, 12 months, 15 months, 18 months, 2 year. Then mostly after that you have a break until age 4.
4 or 5.
Yeah, 4 or 5. Then you get your that's where you get your MMR. At age 4, then you get the second MMR later on. Then one shot that I will say is where I see a lot of resistance is the HPV vaccine.
And why is that?
HPV is a human papillomavirus. It's a vaccine that we start at around age 9, 12. Is 2 shots that we give, and when we do cancer screening for cervical cancer. When we do this, what we're looking at is not only at the lesions in the cervix, but we're looking also, do you have the HPV virus? Because the HPV virus can give you, cervical cancer. So now what we do when you get the HPV vaccine at that age is supposed to go against the HPV so you don't have cervical cancer. But yes, go ahead.
I was going to say, but of note, the vaccine only covers so many types of the virus, okay? Right. It covers some that cause warts, genital warts, and it covers some, as he said, that cause cervical cancer, what we call the high-risk types.
Oh, that's why the commercial says.
I always want people to know that, this isn't a free card.
Right. That's why the commercial always asks you, Mom, did you know?
Right, did you know? This isn't a free card because it doesn't cover all the types.
Yes.
All about 15 of the high-risk types that can cause cervical cancer. And just because you get HPV doesn't mean, if your immune system is good and intact, hopefully you will fight it off and there will be no development of cervical cancer. But then that goes back to coming in, getting your exams, and making sure your doctor making sure that you're getting what you should get. The PAP isn't every year anymore. It's every other year in your 20s, every 3 years, 30 and over, and that's at 30 is when we start testing for HPV. We don't do the tests under 30 unless there's an abnormal PAP. So
and HPV also causes other forms of cancer, anal cancer, throat cancer.
Throat cancer, yeah.
So it's not just important for cervical cancer, but other forms of cancer as well.
And famous people with that, Farrah Fawcett passed from anal cancer, Farrah Fawcett Major, and Michael Douglas admitted he had throat cancer. He proudly kind of admitted that in a way, because of how he got it, but
And is that true? Is that really possible. True that you can get throat cancer from oral sex?
Yes, because it's a HPV.
Because it's HPV virus.
So you have a virus that's there replicating in those cells, and
he was a smoker, I think, too. So therefore, his immune system compromised it. So
And the vaccine is not for girls only.
It's for boys now, thank goodness,
and girls.
Okay.
Right.
Because when
it's
they started,
they said girls only. Where are we getting it from?
Because the men are what we call the reservoir. Okay. They just hold it and ready to spread it.
And they
can have the reservoir,
but they can get penile cancer. So from HPV.
And
so
even
you either stay out of the reservoir or you take your immunization.
Right. And you should vaccinate for HPV as well if you're same-sex couples.
Yes, definitely.
Because you can still have high rates of HPV in same-sex couples as well. So
if you have it, you have it.
And the thing about HIV, if you have it, you can pass it, and then you can also increase the amount of virus that you have within your system as well.
Medication kind of keep it at a level so you don't have to worry about it being increased, if you will. Mm-hmm. Have medication
if they're getting it.
If you're getting it.
I've seen some patients who refuse.
That is if you're getting treatment for it.
They refuse. I've seen that still today.
Hopefully you will be.
But for HIV, the most important today is the prevention. Because there is not only, everybody has to use condom. That definitely help for preventing HIV, but also for high-risk population. There is a medication that you take daily, what we call PrEP, that can help decrease the risk of the transmission of HIV.
You would take that before.
Yeah, if you take PrEP, you need to be tested first. So if you tested negative, so you take PrEP. It's a medication, but you have to take it daily also. And make sure also you continue to use condom, because
Right.
is part of the prevention. And you need to also to be tested every 3 to 4 months, make sure that you're still negative. But PrEP definitely that will help prevent HIV. The only, it can be mostly free, but it's a very expensive medicine.
Right.
If you want to buy it over the counter with no insurance, it costs more than $1,000. If you go to South Africa, it costs $6 per month.
That's all right.
Is that covered by Is that
just-
covered by your insurance?
No, it should be covered by insurance.
It
But
should.
what I'm trying to say, in the medication costs $1,200.
And that's for how many pills? And that you have to take
for
every day.
$30.
Wait,
That's
you
for
have to
30
take every
pills.
day.
Yeah, you take it every day.
30 pills.
30 pills.
$1,200 a month.
Yes. If you go outside the U.S., the same medication costs $6, $7 per month.
And remember too, even if insurance covers it, it may not cover it enough for you to be
Yes.
able to afford it.
Yeah,
It may be
your
500
copay-
instead of 1,200.
Yes,
you
your
know?
copay can be
Still
high.
left hold of the bag
So you need
for
to
it.
go find some coupons or
Right,
other
right.
help to
That's the thing. Like,
And remember,
country and
coupons
come back.
only are good. Most of the time, those coupons, especially if it's a pharmaceutical coupon, you have to have insurance for the coupon.
Yeah.
And then it has to be commercial insurance.
yes.
you can't order the pills from.
I cannot say that.
Okay.
Probably can. But I guess that would be called black market.
Yes.
You know, there was a
trafficking.
time, a minute, for a brief minute, they allowed it, but that got squashed real quick. They were allowing you to get like medications from Canada or whatever. They squashed that really quick.
Yeah. Well, and there's method to their madness, but it doesn't help us much. So eventually, we hope that things will be better pharmaceutically in terms of our insurance. You know, I don't know about the Part B and all of that, and
So in Medicare and that type of thing.
Right.
Because I was going to bring up that question for a person that gave me their 4 medications and wanted to know if there was clinics that was out there that could help with the cost, because they have, Medicaid paid for everything. But once
Yes.
they got Medicare, they didn't.
Anybody can go to the county, to the health department, and they should be able to get some help, mostly for HIV and TB medicine. I know they all free. If you have HIV, those medications most of the time are free. But also you can work with your health department for the prevention.
Right. So the question is, they may give free medication for treatment, but what about the preventive?
Because remember, the president also said, I can remember when, not a long time, that they're going to work towards HIV prevention. And because they have 2 wars now, the one for HIV and the other one is on opioids.
Opioids. We'll see.
Opioids.
Yeah, those are
We'll
the
see
2
if he comes through with that.
health topics that they want to attack and make sure that Americans are safe.
Wow. I tell you, this is kind of mind-blowing that we can be so callous about preventive medicine.
And then remember too, you brought up Medicaid. Remember, I have to tell patients a lot. They move here from other states where it's easier to get Medicaid, but Medicaid is a state-by-state insurance. It's not Medicare is federal, but Medicaid is state. So people come in, patients come in, they complain, I can't get Medicaid here. I came from, mostly it's New York. So I'm like, no, you're in a different state. So
Right.
you may not get it. Probably won't.
Even for veterans,
Well, veterans should have VA.
Yeah, VA.
No? I mean, a veteran veteran?
Yeah,
I don't mean
yes,
somebody
they
who went
should.
to like boot camp and then had to stop.
This is difficult. Our
No, ma'am.
system is broken.
Yes, but
I know it's
if
broken,
you,
but I thought they could still
if you're veterans, you can. I mean, sometimes it can be slow, which is
Slow,
true,
right,
But you
but
can
not-
get help with from the
Yeah.
VA.
it just takes a long time. But if they're a vet,
Veterans should
We'll
be able to
see.
get
It should
the
be easy.
immunizations. Yeah, it should be easier
it
for
should be
veterans.
nice and
Yeah.
pristine for vets. But
It
don't
should
understand why it's
be.
not.
Should be.
It's not.
That's the operative.
Should be.
Should be.
They should have the best facilities,
It should.
best care.
Our veterans air just about every Friday, and it's sad.
It's sad.
It's sad to
It's
know
sad.
that they're not being taken care of.
And that question was from the veteran
Really.
that needs help.
Yeah, well, that's usually the case. Where they're the last to know what's going on. Because they're told last. They're not actually kept informed about preventive medicine or just the general population. That's the sad part. But we have to be a little bit more proactive in our prevention efforts as well. We have to be more proactive and get out there and find the information. And a lot of us just don't really want to know. So, yeah, it takes both parties. And just like the parents are on over the kids and supervise the kids' immunization records and preventive medicine, we have to do that for ourselves as adults. And we can't always count on the doctors to do it for us. We have to be a little bit more concerned ourselves. So here we go. The onus is on us, right?
Yes. Yes.
But I'm going to blame the doctors. That's
Yeah, she did.
I'm going to blame the doctors, okay? But for those of us Americans that have, or internationally even, that have compromised systems, we must make sure that we follow our immunizations. That's our takeaway today. And so are there any other vaccinations that we need during this period? I am speaking spring, summer. Well, what about our allergy immunizations? Are there?
No, there is no vaccinations against.
For that, but we can get.
You can get treatment
Uh-huh.
for
Not vaccination.
yeah, but it's not a
It's
vaccination.
not a vaccination.
No.
Okay. Just treatment.
Those vaccination is
Those are shots too.
public health.
They're shots as well, so they are
Yes,
actually
but-
vaccinations.
But the
Not
they-
technically.
No,
I
not
mean, it's
vaccine.
treatment. Vaccinations is a preventive thing,
Okay.
not
Yeah.
a treatment thing.
Okay.
because if you get the shot for allergy, you already have you're already allergic to that substance. So now we're treating you, so you can get rid of the allergy. But here, you don't have the disease, and we're preventing you from having the disease.
Okay.
It's totally different.
All right. So let's name them again: flu, pneumonia, tetanus,
Shingles.
HPV, shingles,
Whooping cough.
whooping cough.
And no, it's also this MMR, which is measles, mumps, rubella,
Varicella,
varicella,
hepatitis.
hepatitis.
Ah,
Yes,
that's
hepatitis is another very important vaccine. And recently there was outbreak of hepatitis
A in Georgia.
mostly in homeless population. So it's good to make sure that also we have a vaccine against hepatitis A. So those are kind of the main vaccine. But like I said, these vaccines are well. There's a program for those vaccines, and there is an age where you should get those vaccines. And if you don't get those vaccines at that age, we have a catch-up program for you.
Dr. So,
I'm going to have to do a catch-up program.
Yes, there is a catch-up program if you miss your immunization. If
Yes.
for some reason you were living in the
For some reason, the
Blue
reason
Ridge
being,
Mountain and doesn't
don't
want to
like
come
needles.
to mingle with people and being homeschooled, and suddenly
Oh,
you
yeah.
want to go to college. And we say, ma'am, I'm sorry, we have to scratch our head, get catch up.
Speaking of college, though, meningococcal.
We did,
Yes.
yes.
Meningococcal too. It's,
And that's a two-dose vaccine. You get one around the middle school kind of age, just before high school, and then one
Yeah.
going prior to going off to college.
Oh, great.
Because that middle school age is kind of around the time when kids are getting boyfriends and girlfriends, and that's a virus that's transmitted through kissing. So
Oh, like mononucleosis. Okay.
similar.
Mono.
That was meningococcal for meningitis,
yeah,
Okay.
which is kind of a bacteria
bacterial meningitis.
infection in your in brain, and but it's a deadly disease.
It is
if you-
very quickly,
very,
too.
Very
I always
Yeah.
thought mononucleosis was something my parents made up. You know?
To scare you?
Yeah, to scare you.
To do right?
Yeah, you know, because
You to do right.
it helps when you have boy fever, right? That was just a personal thought. I went there. Okay, so children's vaccinations start up
At birth.
at birth.
Right after you come out the womb, before you go home from the
Yeah.
hospital, Hep B vaccine.
Okay. And they go on for a while.
Yes.
Yes, because you need repetition. It's repetition. Sometimes we give you the same vaccine because you need to build up on your immunity. Just one vaccine is not enough to build on your immunity, so it's a repetition. If I want to learn the alphabet today, if you say A, B, C one time to me, it's not going to work. You have to come
Keep
back
saying
and
it.
repeat it and saying it. So that's
Dr.
how
So is
the
teaching today.
And we
Yeah.
retest in pregnancy
Yeah.
for rubella. That's one of the prenatal labs that's drawn. We test for your rubella immune status. So that's part of that measles, mumps, rubella vaccine. So that's one, because like we said, it's live. You can't get that while you're pregnant, but it's given to you before you leave the hospital if you need it.
And then when you go to summer camp this summer, your children go to summer camp, you have to show proof of your immunizations, right?
yes, it's summer camp.
Some camps don't ask you that, but if you've been in school, you have to show
Yeah.
proof
I was
anyway.
wondering, usually you have to show it to start school, but now I'm hearing that you can opt out.
Yes, your parents have to sign a form, but I think it's going to change now. Mostly, I mean, for sure in New York City, there's no opt out anymore.
Yeah, I heard that.
Yeah.
It's mandatory
It's
now
mandatory.
because of the measles outbreak.
Yes, they
Wow.
and they start giving fine of $1,000 per day, not per, but $1,000 fine per day if you don't want to get your vaccine.
Right.
So, which are
Fine. Wait a minute. Did you say
day?
$1,000 a
A
day?
day.
Yes, a day.
a day?
And they say they have
Wow.
started levying it.
Yeah.
Whether they're getting the money is a different thing. I don't know. But
Yeah, I
they're
know.
out
Where do you get
levying
the
it.
money if you don't have the money? You just have it like
I
the
don't know what the
IRS.
repercussion is.
Because there
against
was
you.
this high school kid that was suing his high school because they were kicked out I can't remember if it was the basketball team, and that kid didn't have the vaccine, so they went and sued the school, but they lost because if you're not vaccinated and you want to be with everybody, so you're putting everybody else at risk. So,
Right.
But
So
they
It's not just about
but
that
they
person.
talk about their freedom. They talk about
But then there's the other person's freedom
Yes.
that you're compromising
Yes.
them because you decided not to get
Yeah,
vaccinated.
at some point, where does your freedom infringe upon somebody else's right?
Right,
Yes.
right, exactly.
Well, I have enjoyed all of this discussion today. We have had some great information. We talked about immunization and the impact of not getting them. And so we need to make sure that we continue to get our immunizations all through life. You know, even now, there are things that we need to be protected against. And we can do that with our immunizations. We have to make sure that we remind our doctors it's not just there.
But also we need to talk about autism, because a lot of people say we're not getting the vaccine because vaccine will give you autism.
Okay.
And which is totally wrong. And we know
wrong.
that study was wrong. That was totally wrong.
Why doesn't everybody have autism
Right.
if we're vaccinated?
Right. Okay.
It's, now we screen for autism. It's something that we didn't screen before.
Okay.
So the more you screen, you will discover more kids having autism. And the definition of autism is probably better today than it used to be 20 years ago. But immunization will not give you autism.
Okay. All right. So let's get our vaccinations, our immunization, keep them up to date so that we can be preventive in our, what do you call them, diseases, illnesses that we immunize against. How about that?
Preventable diseases.
Preventable diseases,
yes.
right.
It's primary prevention.
Primary prevention. Okay. All right. And then we go back to our cannabis oil. We're going to see more research on this coming up.
I'm sure it's constantly coming out.
It's constantly.
Please give out your information.
Keep us up to date on
Keep
that.
it up to date.
Yeah. We'll have to have you come back and discuss that
that's
some
it.
more. All right. We will thank all of our audience for joining us today. We've had a wonderful discussion here on cannabis oil and its prevention and its effects on our body. And we've talked about our immunization and keeping them current and up to date. Our guests today have been Dr. Chivon Stubbs, Dr. Janella Thomas Burse, Dr. Charles So, and Nurse Pamela Davis. We thank you all so much for joining us. And the Morehouse School of Medicine, for which Dr. So and Dr. Stubbs work. We thank Morehouse for allowing us to include their doctors, knowledgeable doctors, in our efforts to prevent illness and disease. On For Your Good, I'm Myrna Taylor Ransom. We thank you all for joining us. We thank all of our participants on Facebook Live and YouTube Live. And for all of those who follow us on social media, we thank you for joining us. We will see you next month on For Your Good. Have a good evening.
Thank you.